Hi, ladies and gentlemen, it's Dr. Novoa. I'm really sorry that I had to postpone yesterday. I got stuck in a delivery and some other surgeries, and I'm sorry I'm starting late today. The same situation is that I've just been pretty busy. Nevertheless, I wanted to do this video and presentation because of over the past few weeks and actually past 3 months. We've been getting a lot of referrals, a lot of patients coming in to see us from the local area, obviously, and also from Juarez, and actually from international patients as well. And why I wanted to talk today was because of the something that's been going on for years, not only here in El Paso, but in the entire United States. And that has to do with the fact that it's estimated that probably 50% of all cesarean sections are unnecessary. That means that if you got a cesarean section, you've got a 50% chance that it was unnecessary. And I know that patients always say, well, my doctor told me this and my doctor told me that, and the baby almost died, and I wasn't dilating, or I was told that I had to have one. And in reality, that may be that may be true, but and also in reality, it may be a complete false statement. And the reason that I say it's so important with teens, and especially those coming from the teen centers, is because you don't want to have your teenager undergo an unnecessary cesarean section. Because if she's 15, 16 years old and she wants to have 3 or 4 or 5 children, each cesarean section that's done can be potentially more difficult and potentially risks serious complications for your child, for your teen. I know that we as adults say that always say that our children are always going to be our children, no matter how old they are. And our children, especially if they're teens, they're basically still children having children. And that's a completely separate conversation as to whether or not what the issues are related to our children having children. But the fact of the matter is they are still our children, and we want to make sure that they get the best care possible. And we also want to be aware of exactly what's going on here in El Paso. So let me give you some facts. In 2014, Consumer Reports, which is a national magazine, did an evaluation of over 2,000 hospitals in the United States. And because of the information that was provided, originally the hospitals here in El Paso didn't know what the data was about. So the data was analyzed, and unfortunately, the majority of hospitals here in El Paso ranked as some of the highest hospitals associated with cesarean sections. As a matter of fact, they were so high that they ranked in the top 10 to 20 hospitals in all of the United States related to cesarean section. Now, I'm not blaming the hospital, because the hospitals have been trying their very best to make sure that the C-section rate is as low as it can be, and that the care provided to patients is the best that it can be. And the only way that they can do that is to basically look to the doctors to do what they're supposed to be doing. Look for the doctors to be practicing ethically, professionally, and with the care of their patients in mind. This is the most important things that we're talking about. So what actually has been happening is that the only hospital in El Paso that consistently has been following the national guidelines and has had a percentage that falls within what the Department of Health and Human Services states should be the cesarean section rate for low-risk patients is the University Hospital in Texas Tech. And the main reason for that is that they go by peer review, and so the doctors basically have to explain cases if there's a complication to their peers, and that's really important. So there's a stop sign there. If you run the stop sign, you're going to be asked questions about why did it happen, and that's very important. That's the only hospital in El Paso, again, the only hospital that routinely has been able to meet the national guidelines related to cesarean section have been the University Hospital and Texas Tech program. And mind you that they happen to have the worst cases, the most difficult cases, and yet they have the best C-section rate here in El Paso as compared to other hospitals. Again, I'm not blaming the hospitals. I'm saying that the program is set up in such a manner that they really do have a way of seeing how well the doctors do, and the doctors bringing that information to the forefront for their patients. And that's what's key here. So why do I make it an issue related to the teen centers? The reason that I make it an issue to the teen centers is because the teen centers are set up in a manner to provide you a list of doctors that they are offering related to privileges at their particular hospitals. But there's no accountability of how well those doctors are doing. And teen centers are considered to be, teens are considered to be high-risk patients in the majority of cases. Automatically high-risk patients. So why would you refer a patient of yours or a family member of yours to a doctor who has a significantly high C-section rate, especially one higher than the national average? Now, what I mean by significantly high, right now, the national average is that about 1 out of 3 patients, whether or not they be teens, whether or not they be adults, or even advanced maternal age patients over the age of 35. 1 out of 3 patients is getting a cesarean section. And for low-risk patients, 1 out of 3 patients is getting cesarean sections. So you have a 30 to 35% chance right off the bat of getting a C-section, where in the 1970s, the rate of cesarean section was only 5%. And despite the fact that that rate has increased over the past 30 years, the outcome has not increased. And this is important. I really, really want you to share this video, have friends watch this video right now if they can, to get the message out. You have a 1 in 3 chance right off the bat of getting a C-section if you're pregnant. Some hospitals here in El Paso, you have a 50% chance of getting a C-section right off the bat. A 50-50 chance, flip a coin. Flip a coin, and that's the probability that you're going to get a C-section. And for all the reasoning that you can come up with, all of the explanations that you can come up with, it pales in comparison to what the national average really should be. The recommendation for cesarean section should be in the 20 to 25% range. So if you're getting 50% range, that's, look how high that is. That's twice as high as the national average. Now, some doctors here in El Paso have C-section rates higher than 50%. Some closer to 75%. And so there's no accountability for that. So please, please, please remember that if you've got a teen who's pregnant, ask your doctor what their C-section rate is. Ask that they put it in writing. That they put it in writing what their C-section rate is. What the probability is of a C-section for your child. They're your children, for God's sakes. Okay? They're your children. This is what's happening here in El Paso. Our teens are getting C-sections at rates of greater than 50%, in many cases unnecessarily. Another consideration is that these teens are being referred to hospitals with doctors that work in groups. And many, many times doctors, when they sign out to a group of 3 or 4, they rotate on the weekends. So the fact that your doctor sees you during your pregnancy doesn't guarantee that you're going to be delivered by that doctor. And that happens all the time. So the probability that if you're a high-risk patient, a high-risk teen, and you go into the hospital on a weekend, and your doctor is part of a hospital group or a group of doctors outside of the hospital that has 3 or 4 doctors in that group, you have anywhere between a 25 to a 75% chance that they're going to be delivered by another doctor, a different doctor, a doctor that doesn't know who your child is, a doctor that more likely than not will side on a defensive medicine protocol and section your daughter when it may not be necessary, as compared to the doctor that would have delivered that your daughter had they known who that patient was. So we do practice a lot of defensive medicine here in El Paso, unfortunately, and that does increase the rate of cesarean section. And what do I mean by defensive medicine? Defensive medicine means that you're doing something in order to avoid getting a lawsuit, in order to avoid getting sued over it. It doesn't necessarily mean that you're doing a better job. It doesn't necessarily mean that you're protecting that patient. You're doing it because you're worried about getting sued. And when you start doing that, that's where the C-section rate keeps going up, and why it's estimated in the United States that 50% of all C-sections are unnecessary. So again, we fall back to the fact that your 15, 16, 17-year-old daughter is getting a C-section that's unnecessary with no accountability. No accountability. And this is happening hundreds of times a month. Now, that's just your teens. Now, look at ladies that you're already pregnant, or you've had vaginal deliveries. What is the probability that the doctor that's managing your care is going to end up giving you a cesarean section? And what is the probability that that doctor is going to actually be honest with you, tell you the truth, and not practice defensive medicine? Depending on the hospital, not the hospital, depending on the doctor that practices at that hospital, you have anywhere between a 30 and a 50%, maybe a 70% chance that you're going to get a C-section that's unnecessary. That is the facts. They are the facts, and why I wanted to do this video. Because why? Because in my practice, we see a significant number of VBAC patients that have had a previous cesarean section that are attempting a vaginal delivery. So right now I've got 75 to 80 patients that are attempting a vaginal birth after cesarean section. Vaginal birth after cesarean section, in the majority of cases, should be something that's offered to every single patient. Every single patient should be at least discussed vaginal birth after cesarean section if they've only had one C-section. Now, when we evaluate patients, 9 out of 10 of those patients are good candidates for a vaginal birth after cesarean section. Very rarely are you going to get a straight answer from doctors that don't do VBACs, even though the national societies and international societies strongly encourage doctors to be offering VBAC to their patients. So if your doctor didn't mention VBAC to you, if your doctor doesn't offer VBAC to you, then they're not following the national and international guidelines. And questionable informed consent. Again, this is so important. If you've had a previous cesarean delivery and you wanted to try for a vaginal delivery, 9 times out of 10, you're a good candidate for the VBAC. But less than 1 to 5% of doctors here in El Paso even offer the VBAC. So right off the bat, you're almost going to get guaranteed that you're going to get another C-section, even though you should have been offered the VBAC, or the vaginal birth after cesarean section. So you end up with a C-section, and if you want to have more than 3 kids, more than 5 kids, each C-section that you have, there's an increased risk of a complication related to that. Now, what is the complication risk? And this is something that I've argued time and time again, and especially for nurses in the hospital that are giving the wrong information, sharing the wrong information because of the fact that their doctors are passing along the wrong information. This is the correct information. If you've had between 1 and 3 cesarean sections, the probability of having a serious complication related to your cesarean section is less than 1% chance. 1% chance that that's going to happen. If you have more than 3 cesarean sections, it goes up from 1%. If you've had 6 cesarean sections, the probability goes up to 9%. 9% chance that you might have a complication. There are doctors out there, there are nurses out there that are actually telling patients that if you have more than 3 C-sections, it's dangerous. It's a dangerous situation, and you should get your tubes tied. This is absolutely false information, and a significant number of women, unfortunately, have had to go through sterilization before they were done having all of the kids that they wanted to have. Why? Because they were getting the wrong information from doctors. They were getting the wrong information from nurses. They were getting the wrong information from people, that their friends and family, because they were told the same things from doctors and nurses. Ladies, you are getting sterilized sooner than you need to. There is no reason for this to happen, and it's happening every single day in El Paso. Please get this message out. Please ask, why am I getting my tubes tied when I don't want to? I am now being told that 3 C-sections does not necessarily mean that I have to get my tubes tied and not have a larger family than 3 babies. That is the facts. That is the truth related to this subject. Also, when you get your tubes tied, you run into the issues related to post-tubal ligation syndrome. which is a change in the menstrual cycle, cognitive changes, hormonal changes that permanently affect women related to having their tubes tied. You don't get these messages from doctors because most of us don't even believe that tubal ligation syndrome exists. I do believe that it exists. I've done over 1,000 tubal ligations. Approximately 3% of my patients have issues with their tubal ligations. This is something that we strongly discuss. We strongly recommend. Now, let's talk about what's going on in other states, because this issue in El Paso is nationwide. And so if you can share this video with friends and family, I strongly recommend you do so. The best hospitals to go to are those that have peer review and those that are university-based, residency-based. Even though you don't really want to be delivered by a resident, I feel that you're going to get some of the best quality care through the residency programs, because there is peer review and there is going to be some type of accountability, a very strong accountability through the university programs. That is why the University and Texas Tech program here in El Paso is so good, because there is accountability, because there is a peer review system that's set up. When you go into private practice, you can practice any way you want. And that's why board certification in obstetrics and gynecology, as far as I'm concerned, is a farce. It is something, just once you get board certified, you can do whatever you want to once you leave that room. And that's exactly what's happening. Board certification does not guarantee anything, even by its own description online. Board certification, the board of the American Board of Obstetrics and Gynecology, does not guarantee any of the work that is done by the doctors that it board certifies. That's where accountability comes into play. So, take-home message. Number one, the C-section rate is way too high. You have a 1 in 3 chance right off the bat of getting a C-section. If 50% of C-sections are unnecessary. Some doctors, C-section rates are higher than 50, sometimes it's higher than 70% with no accountability. Our teens, which are considered high-risk groups, are getting C-section rates at 30 to 50% probability when they don't need to be. And that is something that's really, really important. If you care about your kids, if you care about your teens, pass the message on, get the message out. So people say, well, Dr. Novoa, well, what about you? What is your C-section rate? What is your accountability rate? If you go to my website right now, drnovoa.com, you can look and you can find my statistics. For the past 10 years, I've documented every month. For the past 10 years, I have documented every month how many deliveries I do, how many C-sections I do, how many vaginal births I do, and how many VBACs I do. My C-section rate is between 4 and 5%. The same C-section rate that my father had, that his colleagues had back in the 1970s. As far as I'm concerned, I've managed a high-risk group of patients. There is no reason why the C-section rate shouldn't be between 5 and 10%. That's just telling you how it is from my practice. I delivered somewhere between 4,000 and 5,000 babies. That is a 10-year documentation, going all the way back to residency. I still practice how I practice in residency. My C-section rate for low-risk patients, as defined by the national standards, is a 4 to 5% C-section rate, with the same outcome and same benefits as for those doctors that have 50 to 70% C-section rates as far as the babies are concerned. You never want to do a C-section unless it's necessary. That is my C-section rate, 5% in the low-risk group. Okay, Dr. Novoa, what is your VBAC success rate? You have a high-risk group of patients that are attempting a vaginal birth after they've already had a cesarean section. What is your vaginal birth after cesarean section rate? My vaginal birth after cesarean section rate, based on a 10-year documentation that you can find online, is approximately a 6% failure rate. So a 94 to 93% probability that if you attempt a vaginal delivery after a previous cesarean section, you will have a vaginal delivery. These numbers are exceptional as far as comparison to other doctors. That's why I have to post them, because no one I'm always asked, how could they be so low? I put it in writing. I put it in writing. I give it to my patients. This is what you need to ask. In order to get accountability, you need to get it in writing. And I provide that in writing to my patients. I provide it to my teens. I provide it to all of my patients. I provide it to my VBAC patients. It's also part of the information given as informed consent at the hospital. So this is why I wanted to talk to you today. Thank you so much for listening. The next subject that we're going to go to is breast implants. Now, many of you know that I am a cosmetic surgeon. I am both an OBGYN and a cosmetic surgeon. I have been a cosmetic surgeon for coming on 20 years. I started doing cosmetic vaginal surgery back in 1999. Since that time, I've expanded my practice to include fully conscious breast augmentation, liposuction, lipoabdominoplasty, vaginal rejuvenation surgery, Brazilian butt lifts. I do all of that. What we wanted to talk to you about today are related to breast implants. Since I am a cosmetic surgeon, of course, I placed a significant number of breast implants in my patients. I stopped counting after 3,000 fully conscious breast augmentations, but that's how many breast augmentations I've done. In that group, there's only been 2 patients that have ever gotten textured implants. All of the rest of them have been smooth. If you haven't heard already, there is a serious concern related to a condition related to breast implants, a lymphoma cancer called breast implant associated anaplastic large cell lymphoma. It is a cancer of the lymphoma, lymphocytic tissue associated with breast implants, and it's been mainly associated with textured implants. Statistically, the probability associated with smooth implants is the same in the general population, and so they're still focusing in on textured implants. Now, this is why I wanted to tell you, all of the cosmetic surgeons, all of the plastic surgeons were notified related to this issue more than 5 years ago. Their societies have known about it for more than 5 years, and the Food and Drug Administration has known about this condition for almost 10 years. So all of the breast implant groups, if you haven't known about this, I'm sure that you have known about this. The issues with breast implant associated anaplastic large cell lymphoma has been something that plastic surgeons and cosmetic surgeons have known for more than 5 years. So if you got textured implants placed 5 years ago or less, your doctor did not properly inform you about this condition, you have a serious informed consent issue, which I strongly recommend you get more information about, and in some cases seek legal counsel related to it. Next, the reason that I want to talk about breast implants is that this particular condition has not been associated with smooth implants. Nevertheless, something very important, all implants, whether or not they be breast implants, E-short devices, the Felshi clips, the Holka clips, the IUDs, hip implants, any type of foreign body that's placed into your body causes or induces a foreign body reaction. These foreign body reactions can cause cognitive, systemic changes in women and men. Of course, implants are placed in men as well. So, if you've had a side effect to the implant, it may be anything from head to toe. It can be causing cognitive changes, memory lapses, emotional changes, anxiety issues. It can cause, of course, the significant weight gain, joint pain, syndrome similar to hypothyroidism, Sjogren's syndrome, fibromyalgia, rheumatoid arthritis, chronic fatigue syndrome, chronic pain syndrome. All of these things are common or have been associated with foreign bodies and such as breast implants, and these are key to understand. The issues related to the breast implants, the most common complication, the most common foreign body reaction that occurs in anywhere between 5 and 25% of women or men that have breast implants is going to be the capsular contracture. If you haven't been told about capsular contracture, it is a foreign body reaction where your body rejects your implant. At first, we thought that they were associated with infection, contamination, Now we know that they're more commonly associated with simple foreign body reaction. So ladies, if you've gotten, and men, if you've gotten breast implants, you have a 5 to 25% probability of developing a capsular contracture. It is a foreign body reaction. It is recommended you get the implant removed. Whether or not you get the capsule removed or separate the capsule is a controversial subject, but it's still very, very important. So how long does it take to get a foreign body reaction? How long does it take to get a capsular contracture? That can occur within just a few months of getting your breast implants placed, or it can be 10 years after you get your breast implants placed. The FDA has recently sent out draft information related to breast implants. Ladies and gentlemen, if you've been told that your breast implants are considered permanent devices that do not have to be removed, you have been misinformed. Your breast implants, whether or not they be saline or silicone implants, it is recommended that they be removed and replaced every 10 years. Gummy bear implants included. Again, if you have been told that your breast implants, and most commonly now, the gummy bear implants that you have in place are permanent implants that do not have to be removed, you have been misinformed by your doctor. I strongly recommend that you get the recommended MRIs done every 3 years if you've got silicone implants in place, and that you get those implants replaced every 10 years, because the probability of a silent rupture or an occult rupture of your implants increases by 1% after the 10-year period of time, with a probable rupture of your implant within that 10-year period of time of between 1 and 5%. So that's what I wanted to explain related to breast implants. They're not permanent devices. They're all associated with foreign body reactions. The severity of the foreign body reaction is important to understand. Capsular contracture being the most common. 5 to 25% of patients will get that, or the more systemic reactions, such as the conditions that are all autoimmune. Next, if you've gotten breast implants placed and you have an underlying autoimmune condition such as hypothyroidism, diabetes, fibromyalgia, you should have been informed that the possibility of a foreign body reaction increases when you have a foreign body placed and you already have an autoimmune condition. We have seen that the conditions of hypothyroidism, diabetes, other conditions worsen once you get implants placed. So it is relatively a relative concern that a person that has already these conditions have breast implants placed. Again, that's the take-home message related to that. My last and most concerning commentary has to do with women that have had breast cancer, already have breast cancer, and have had their breast removed or a portion of their breast removed and the muscle removed, that doctors are placing breast implants in this group of women. Ladies and gentlemen, if you don't already know, you are already at an increased risk of having a foreign body reaction if you've had cancer. You have a 30 to 50% chance, depending on the patient, of having a reaction to the implants placed if you've had breast cancer. Reconstructive breast cancer surgery, including breast implants, are not a good choice for the majority of women, because they have anywhere between a 25 and a 50% chance that they're going to need some type of secondary, third or fourth surgery to repair the complications associated with placing a breast implant. How can we justify placing breast implants in a woman that has had breast cancer when she's had to go through that tragedy without properly explaining to her and her properly understanding that you have a 25 to 35, 45% chance of having a complication with that implant placed inside of your body? Now, I'm not suggesting that the women that don't have problems with their implants get their implants removed. In the vast majority of cases, women that have had breast implants have a very, very good course with them. I strongly recommend that my patients, if they have any issues, they come in for an appointment. We can talk about it to reassure them that, listen, the breast implants look fine. There's no problem. But if they start to have symptoms, I want to not just dismiss it. I want doctors to stop dismissing it. I want plastic surgeons especially to stop dismissing these issues. And hypocritical, as well as what I call cover your butt scenario. If a plastic surgeon placed implants into a patient when he knew that he shouldn't have or didn't properly inform that patient about it, of course they're going to downplay the complications. Of course they're going to say that there's nothing wrong. I always recommend that you get a second, third, or maybe a fourth opinion from both plastic surgeons and cosmetic surgeons, because we have different philosophies on the management and care. Get an opinion from your rheumatologist, your primary care doctor. Just because they don't place breast implants doesn't mean that they don't understand what can happen when the implants are placed. This is exceptionally important. I hope that this information will get out there. I hope that you share this. If you care about your family members, if you care about your teens, if you care about yourself, your community, your friends, please share this video. I hope that doctors will start to make more of these videos. We need to start thinking about our patients and stop thinking about ourselves. We need to start thinking about our community and stop thinking about how much money we can make. That's why I've been doing what I've been doing for more than 10 years, why I've been sharing all of the Facebook messages that I have, why I've been on Facebook for 7 years answering questions. And I apologize if I haven't been on for the past few months. It just became overwhelming. I will continue to do videos. I will post this on YouTube. I hope that everybody that has a family member that's ever been pregnant, that has a family member that has ever had breast implants or any type of implants, please go ahead and post this video, share this video. Final message, if you haven't had an opportunity, please go to Netflix and download or watch the movie The Bleeding Edge. It talks about the issues related to the Food and Drug Administration, the issues related to Big Pharma, the issues related to manufacturers of implants, the issues that are harming women and men in the United States, and why and what we need to do to fix it, and what hasn't been done that's making it worse. I hope, again, take the time to go on Netflix, download the Bleeding Edge documentary. I do a narrative introduction and a part of that documentary, so I can actually endorse what it says. I'm in great support of that particular documentary, great support of the eShore Problems Forum. We were able to change things with eShore Problems, and we're still working to try to fix things with eShore Problems. We're working in Europe related to that, and we also are working with other associations, companies that will help you as far as finding or tracking your breast implants, finding or tracking your implants in general, so that you can be notified about that. That's a separate video. I'll talk about that again. Nevertheless, I hope that this has been informative. Please share it with anybody that you know that's ever been pregnant, anyone that's ever had an implant placed, especially the breast implants. And I hope to be able to do another video very soon. I hope this helps you out. Thank you so much for watching. Take care. Bye-bye.